Hi friends, good morning. This is Dr. Sheetal Agarwal from Apollo Spectra, and today again a very interesting, very hot topic on demand which I am going to speak regarding hymenoplasty. So what exactly is hymenoplasty? क्यों करते हैं? What is the procedure? I'm going to discuss everything in detail. Hi Shivani, nice to see you. So before we go for hymenoplasty, hymen होता क्या है? Hymen is a semicircular tissue which is covering the vaginal opening. It's a semilunar tissue which is covering the vaginal opening. It could be thin, friable, flexible, or it could be thick and rigid. Now, why it is so important? Hymen, there is so much importance given to hymen which has practically no role in our body. Like appendix, this tissue has no role in our body. Basically, hymen is a sign of virginity. In many cultures, in many religions, hymen is considered as a sign of virginity. So the girls get panic when they feel that their hymen is torn, and it is not necessary that hymen is torn by the actual sex or by the actual act of penetration. Hymen can be torn while you are doing sports like cycling, horse riding, long jumping. Even while using tampons, hymen can be torn. And it can be torn even you have gone to a gynaec, and if she does gentle one finger examination, your hymen can be torn. So there is no big issue for this hymen to be torn. Then why such importance is given to such this vestigial organ ki hymen hai torn ho gaya? It is because in many cultures, in many customs, to have an intact hymen is considered to be sign of virginity, and because of which the females, they get tensed that their hymen may be torn. Now, what are the conditions in which hymen can be torn? As I have told you, sex could be one, and various other sexual sports activity. So, what is hymenoplasty? Hymenoplasty एक surgical procedure होता है where we restore the hymen. किन conditions में करा जाता है? Normally, मेरे पास जो patients आते हैं, either they have had undergone some sexual abuse at some point of time in their life, and they have gone through so much of mental, physical, psychological trauma that for them to have to restore their hymen gives them some peace of mind that yes, my hymen is restored and I have become a virgin again. Then what other set of people come to me? Normally in their adolescent age, when the hormones are at their surge, hormones are surging in the body of a female, she likes to experiment her sexuality. She likes to, feel her various sexuality, and under peer pressure, she may do masturbation, she may go for sexual activity, which she later regrets. When she becomes mature enough, she regrets that why did she indulge in all that sexual activity under peer pressure, just out of curiosity, exploring her sexuality, her sensuality, she may do it. These kind of people, when they have this, they have that guilt feeling in their mind, they come and they say to restore their hymen, and we do it, and it gives them a peace of mind. Third set of people who come to me for hymenoplasty is generally for the cultural regions or religious regions, that they have had sexual partners. Now they are planning to get married, and they would like to restore their hymen so that they can present themselves as virgin to their future partners. And of course, we go for that also. Here I would like to say that hymen is, as I told you, it is a semicircular covering the vaginal os, not completely covering it, because if it completely covers the vaginal opening, there will be no outlet for menstrual flow. In certain situations, the hymen completely covers the vaginal opening. We call it imperforate hymen. Now, this imperforate hymen, young girl will have periods, but these menstrual blood will not be able to come out because the hymen is completely covering the vaginal opening. She will have cyclical pain in her body, periodical pain at the time of her menses, but there will be no outflow of menstrual blood. That condition is called imperforate hymen. Again, it is a sort of gynaec emergency where we, do crisscross cruciate incision at the hymen so that the menstrual blood comes out. So that is another form of I will not call it hymenoplasty, but hymenotomy, where we cut the hymen. So this is what exactly is hymenoplasty? We repair It is a very simple procedure, girls. It is very simple. It is a simple daycare procedure. You need not require to be admitted in the hospital. It is done under local anesthesia. We repair the vagina, make it semicircular using a very fine stitch, which we don't even have to cut it. It is a dissolvable, very fine suture material is used, and we use microsurgical instruments to reconstruct the vagina. The best part is that we don't have to remove the stitch, and it is dissolvable, and it dissolves in due course. Say in around 3 to 6 weeks time, that stitch gets dissolved. So any precautions, any test, pre-op test, not much. We just go for routine CBC, sugar, urine and viral markers. Not much test. Patient gets admitted in the morning, by evening she gets discharged. So what precautions she should take? Okay, now that she has got hymenoplasty done, क्या precautions वो लेगी so that she doesn't torn her vagina? First and foremost, she should not indulge in sex for a minimum of 6 weeks. Very important, because if 6 weeks before the hymen is completely formed, she indulges in sex, she will torn her hymen again. She should take her antibiotics in time, because we don't want the stitch to get infected at any point of time, because if it gets infected, our repair will be failed. And what will be the signs of infection? She will have pain while walking, she will have false smelling discharge, she will have swelling in that area. So we advise them to take antibiotics in time, to take hot sitz bath, to avoid strenuous activity, to not do body lifting after weightlifting, to not do any weightlifting after hymenoplasty for a minimum of 3 to 4 weeks. 6 weeks, abstain from sex. So ladies, like you're planning to get married, say in 2 to 3 months time, my advice is get hymenoplasty done minimum 2 months before your due date. So due date of surgery, due date of marriage, so that you give yourself, your body 6 weeks time for the hymen to be completely formed. So that when you have your, after marriage, when you have your sex with your partner, you have some amount of bleeding. Though here again I would like to suggest that even if you have intact hymen, it is not necessary कि आप bleed करोगे ही करोगे. जैसा मैंने बोला है कि sometimes hymen is very thin, very friable, it has lax, very lax hymen. It may not bleed at the time of first intercourse. So to bleed with intact hymen during first intercourse is not necessary. So that is also a myth which you must take out from your mind. So hymenoplasty, take home message, hymenoplasty is a very simple procedure. It is a daycare procedure. It can be done by a good gynecologist with good expertise in her surgical field in doing this cosmetic surgical procedure. Here, yes, Sanjana, you are asking me about the cost of hymenoplasty. It depends upon which category of room you take. It can vary from 30,000 to 60,000-70,000. Total cost, I'm telling you, this includes the hospital charges, my charges, drug charges, everything. Chinni, you are saying that you are suffering from thyroid, TSH is 108. And you're taking 108 is a very high TSH. Please consult an endocrinologist, because this is going to affect your fertility. This is going to affect your menstrual cycle. So you are saying how to cure this. Is it needed to follow a diet? Basically, you have to be very regular with your Theranorm or Altroxin, whatever tablet you are taking. You have to take it first thing, empty stomach in the morning. And I think you have to increase your dose. So whichever doctor you are seen for this, your hypothyroidism, please go back to him. 108 is very high hypothyroidism. You cannot become pregnant with this. And in case you become pregnant, it is going to affect your baby. The baby can have congenital hypothyroidism also. Harry saying, is masturbation wrong? No, Harry, masturbation is not wrong. As I have told you, once you are in your age, adolescent age, or your hormones are surging, you try to experiment with various sexual orientation of your body, and one of that is masturbation. It is pretty normal. It is a pretty normal let off of your feelings. Don't feel guilty about it. So, friends, this was all I wanted to talk about hymenoplasty, because I was getting lots and lots of queries regarding hymenoplasty, not only from India but from abroad, from UAE, Dubai, Middle East countries. I thought once and for all, let me clear it, that hymenoplasty is a safe procedure, it is a daycare procedure, it is not an expensive procedure, and anybody who wants to do can get it done. Hi Shweta, you're saying, is it normal if there is no bleeding during the first intercourse? I have already stated it is very much normal, because many a times the hymen is very thin, it is very flexible, and it may not bleed, it may not get torn also during first intercourse, and it may not bleed, so it is very much normal. So another, I have PCOD problems, Nazra PCOD में I have 2 or 3 videos of mine have been released, please go through them. शिवानी सिंह की अगर सेक्स की इच्छा हो तो क्या कर सकते हैं? शिवानी, if you have a partner, please go and enjoy sex with that partner. If you don't have a partner, you can very much indulge in masturbation. Masturbation is not wrong, and don't feel guilty about it. So this is all for today. I wanted to clear certain myths about hymenoplasty and how we do it, and how it is not an expensive procedure, so many girls can come forward with it and get it done. That's all for today. Next Saturday, again, a very interesting topic I'm going to come with. Bye, take care, and have a very nice weekend. Please take care of yourself.